After more than 2 weeks of intense protests by private and some government doctors over the right to health or RTH Bill in Rajasthan, they reached an agreement with the state government, especially over private hospitals covered under the bill, and called off their protests today. Announcing an end to the protests, Rajasthan Chief Minister Ashok Gehlot said, and I quote, "I am happy that finally an agreement has been reached between the government and the doctors on right to health, and Rajasthan has become the first state in the country to implement right to health. I hope that the doctor-patient relationship will remain the same in future as well. Hashtag right to health." The hospitals to be included in RTH will include 4 categories of hospitals. Those are private medical college hospitals, hospitals established on PPP mode, hospitals established after taking land from the government free of cost or on subsidized rates, and fourth, and hospitals run by trusts, those funded by the government in form of land and building. Another point in the agreement is that police cases and other cases registered during agitation shall be withdrawn, and that there will be a single window system for licenses and other approvals for hospitals. Moreover, the renewal of the fire no objection certificate or NOC for hospitals will be done every 5 years, and any further change in rules will be made after consultation with 2 representatives of IMA as per the agreement. Earlier, a series of talks were held between doctors and Chief Secretary Usha Sharma at her residence from 2 a.m. to 5 a.m. on Tuesday. Principal Secretary Akhil Arora and Medical Education Secretary TV Ravikant were also present at the meeting. According to the sources, the doctors had agreed on 3 conditions. Number 1, only those hospitals who have got help from government will implement RTH in phase 1. Those who want to implement RTH can go ahead. Number 2, hospitals with less than 50 beds will not implement RTH. Number 3, in future, if any amendment has to be made, the 2 representatives of Indian Medical Association will be included in it. According to the bill earlier, every resident of the state would have the right to emergency treatment and care without prepayment in any public health institution, healthcare establishment and designated healthcare centers. And in accordance with the bill earlier, the government would cover the expense of the treatment and reimburse the private hospitals and clinics. However, that was not accepted by the clinics and private hospitals. Further, before modification, the bill also permitted any citizen of the state to avail health benefits in any recognized clinic.